Top Med Talk.
Hello, my name's Nick Majerus and welcome to Top Med Talk Conference Highlights. On today's conference highlight, we have ASER 2018, a moment when our reporter Dr. Joff Lacey got hold of Dr. Matt McEvoy from Vanderbilt University and had a discussion with him about post-operative monitoring. Now, for us, this was a huge takeaway moment from ASER 2018. Have a little listen and see what you think.
Top Med Talk.
So we've just finished a very lively session on perioperative management of blood pressure, and I've been able to drag to one side one of the speakers of the session, Dr. Matt McEvoy from Vanderbilt University, and I just wanted to revisit with him a couple of stats that he put up on one of his slides about post-operative monitoring, and it really instigated quite a lively and inflammatory debate about how we manage patients in the monitor patients in the post-operative period. So Matt, thanks for taking a few moments to chat to me. Can you just tell us what the information you put up on the slide and what it can tell us about how we should be managing patients?
So the topic was the amount of basically vital sign disturbances that occur in the post-op period when you have continuous monitoring, and the frequency with which our standard monitoring techniques miss that, or our standard regimens, meaning the idea of vitals Q4 hours post-op. And one of the studies has shown that if you take elective general surgery patients, intra-abdominal surgery, who were over the age of 60, and they monitor them continuously for the first 6 hours post-op. So this isn't middle of the night sort of thing. This is, in the afternoon, early evening, day of surgery, that when they went to the ward, you had 80% of them had at least one episode of bradypnea, defined as less than 8 breaths per minute. 60% had at least one episode of apnea, so a cessation of breathing for greater than a minute. And the median number of events per patient was 10 bradypnias and 3 apneas. Now, again, that's not in a hospital stay. That's in the first 6 hours post-op.
It's a shock. I assume you were surprised as the audience about that when you first read it?
Yes. If someone had said this was emergency general surgery, it was septic patients who were 75 years old and got too much opioids. But
this is our routine patient.
This is your routine patient. And to me, that's the striking thing. And the same thing, there was another study looking at if you monitor not the respiratory rate, but you look at saturations or desaturations, that 20% of patients, so 1 in 5 of your routine patients, have more than an hour of SATs less than 90%. If you then say that you take that to they have more than 10 minutes per hour. If you take that to 20 minutes per hour, it goes down to 8%, but you're still 1 in 12 of your routine patients having a saturation less than 90% for more than 20 minutes per hour. And then if you say, well, maybe that's not clinically relevant, they looked at those who were less than 85%, which everyone would agree, you're definitely intervening at that point. Yeah. And most people are, the truth is, even at 90%, that 1 in 12 patients were having more than 5 minutes per hour. 90% of all of that is missed by the standard monitoring protocols. I want to be very careful not to say that ward nurses are doing a bad job. No. The system that we have sets them up to miss that. As you begin to just peek under this rock at all for our routine patients, we're finding that there's a lot of things under there that we don't want to see. But when we look at those, we have lots of association in data that there's really increased harm and increased risk to our patients. And so the idea of better monitoring of the routine patient could potentially improve outcomes tremendously.
Top Med Talk.
Top Med Talk's very own Dr. Joff Lacey there, speaking to Dr. Matt McEvoy from Vanderbilt University. Don't forget, this is taken from a longer conversation recorded by Dr. Joff Lacey at ASER 2018. If you want to find it, all you need to do is look for a podcast titled Monitoring Patients in the Post-Operative Period. A big takeaway for us at ASER 2018. What about you? What were your big takeaways from ASER 2018? contact@topmedtalk.com is our email address. Tell us your highlights. That's contact@topmedtalk.com.